Hi, and welcome back to Preserve Health Talks. I'm Dr. Ira Perlstein,
And I'm Leah again,
and our guest today is the invisible but always present Dr. Justin Case.
just in
So
case.
he's got a pill for everything, even when you don't need it. We have patients come into our office all the time and say, "Can you give me a water pill just in case? Can you give me steroids just in case? I've got a tickle in the back of my throat. Can I have an antibiotic just in case?" Let's talk about why we don't like Dr. Just in Case. He's not
Yes.
as well trained as he thinks he is.
No, no. One of our, I would say our top common doctor just in case situations is doctor just in case says, why not take antibiotics just in case that sore throat turns into something serious? What's the harm in that?
Well, there's a lot of harm in that. First of all, it creates a lot of bacterial or antibiotic resistance, making future infections harder to treat. Bacteria aren't stupid, they're very smart, and they learn how to resist certain antibiotics. Patients always say, "I'm immune to penicillin," or "I'm immune to a cephalosporin." Patients that become immune to antibiotics, in essence, what happens is bacteria learn how to outsmart these antibiotics so that they can persist and become resistant to them. And the more you put people on antibiotics just in case, the more likely you are to develop bacterial resistance.
And it being on antibiotics will also kill the good bacteria, the healthy gut bacteria, which can lead to diarrhea, yeast infections, C. diff, which you do not
Yeah,
want.
you do not want C. diff. We've had a few patients with C. diff. That's an abbreviation for a bacteria called Clostridium difficile, in the same family as Clostridium botulinum, which is botulism toxin. So you wouldn't want botulism, but a less virulent pathogen is the Clostridium difficile, which just causes copious and hard to control diarrhea, often requiring hospitalization. Plus, being on antibiotics unnecessarily increases the chance that you may, in turn, develop an allergic reaction or a serious side effect from an antibiotic. Like what? Well, like tendon damage from quinolones, Cipro, for instance. I think I might have a urinary tract infection. Can you give me Cipro just in case? Well, if you combine Cipro, which is ciprofloxacin, and you're already on, let's say, a statin medication, you have an increased chance of developing tendon rupture. And then, if you're on certain rheumatologic medications, for instance, hydroxychloroquine, okay, that can react with several different antibiotics. So antibiotics are not good. And
No.
no, they're horrible.
Well, and plus a lot of patients present with sore throat, the sniffles, the sneezes. It's most often viral. So antibiotics are just useless and it can create more harm in
Right.
the long run.
95+% of upper respiratory infections are viral. Well, I think I might have strep throat. I woke up with a sore throat. There are criteria for strep. First of all, we can strep test you. And the only reason you treat strep is to prevent the development of bacterial heart disease, endocarditis. And you can usually treat that with a single dose of penicillin. You don't
Right.
need to be on penicillin for days and days and days. But the likelihood of having strep after the age of 40 years of age is very low.
Right.
Strep throat infections are disease of younger people.
Right. And also we just prescribing medications just in case to give patients, they can then create a stockpile and play doctor overseas if they're on a vacation in Italy and they have everything under the sun, all these prescriptions, and then they don't consult their doctor. And then they just start taking medications. They're playing pharmacist. There's so many interactions. It's just a disaster.
Absolutely. So I asked Dr. Justin Case to give me an example of what he would do in a situation like this. So he told me about one of his patients, Tom, and Tom was a 35-year-old who came to see him with a scratch in his throat and a stuffy nose. He didn't have any fever, he didn't have any chills, he had no what we call constitutional symptoms.
Right.
He just woke up with a man cold.
Yep.
Okay? But Dr. Justin Case went ahead and gave him a 5-day course of Zithromax. I mean, what's the harm, right? We'll just put you on a Z-Pack. Well, what are the risks of that?
The risks are, of course, resistance to antibiotics. If this is a patient who sees Dr. Justin Case every month, then that's very concerning for resistance to antibiotics, as well as the unnecessary side effects of antibiotics. So GI upset, rash, if they're allergic to that medication. And then it just reinforces the idea to that patient that they can go see Dr. Justin Case to fix every little sniff and sniffles and sneezes that they have. Now, a sore throat and stuffy nose, what if that's allergies? Have we tried anything else? Right? But just in case.
Just in case. Dr. Justin Case would start you on antibiotics.
Yeah.
We at Preserve Health will not do that.
We will
No,
not.
we will definitely not. Okay, so I'm on a cruise, and I'm sitting at a dinner table. You know how they seat you on a cruise ship, and
Yes.
guess who's at the table with me?
Is it Dr. Justin Case?
It was Dr. Justin Case. And one of the guests at the table said, you know, my rings are tight. And I looked and my shoes were tight, not thinking that it could be the humidity, the salt air,
The cruise food.
the excess salt. And Dr. Justin Case said, don't worry about it. I'll just put you on a diuretic and you won't swell. What's the harm of that?
There's so many harms. So first, electrolyte loss. So certain diuretics can cause hypokalemia, hyperkalemia, hyponatremia, so low sodium, low potassium. Some of them can be potassium sparing. I don't know what Dr. Justin Case is prescribing. And then it can be treating symptoms that are not caused by like being on a water pill. So, and it can also mask serious conditions. What if they have heart failure and he's just encasing them with a diuretic?
Yeah, and overdosing or on diuretics, taking a diuretic every day, you can get dehydrated.
You can become hypotensive, low blood pressure.
Yeah, low blood pressure. You can fall. You can break a bone.
Oh my goodness.
You can develop heart arrhythmias with low potassium. And if your sodium drops below 120, you can have seizures.
Very dangerous.
Yeah, but just in case, we better start you on that diuretic.
Yes.
So it does mask underlying issues like heart disease, liver disease, kidney disease, and that low blood pressure drop. So I try to convince Dr. Justin Case during that cruise ship dinner, this is not a good idea.
No.
And he told me about one of his weekend warrior patients.
Oh, yeah.
Janet.
Very common.
You know, Janet, 48 years old, and she was taking a water pill every day because she noticed some ankle swelling, and it really could mask some serious conditions. You know, ankle swelling is kind of common in older people.
It is.
Yeah.
So many different
Yeah,
factors.
venous
can contribute
stasis,
to that.
varicose veins.
Right.
Lots of things.
One of the common patients I think that Dr. Justin Case sees would be a patient over the weekend, just in case they're prescribed some 600 or even 800 milligram ibuprofen, just in case they get sore from that tennis match that they do or playing golf. What are the risks with that?
Oh, lots of risks. Stomach ulcers,
Yes.
gastrointestinal bleeding, even perforation. And if you're outside working in the hot sun and you get dehydrated and you take anti-inflammatory medications, you run the risk of permanent kidney injury,
Right.
kidney damage,
Yep.
heart attacks. Anti-inflammatories are, even though they cause GI bleeding, that's from the irritation, but they are actually pro-thrombotic. They promote blood clotting. And so if you have a history of heart disease, you can promote the risk of heart attack or even stroke on high-dose chronic anti-inflammatory medications. But Dr. Justin Case, he wouldn't listen. He saw Marie, 48 years old, who wanted 600 milligrams of ibuprofen 3 times a day in case she got sore playing tennis with her friends on the weekend.
Yeah.
And he did it.
Yep. And I think probably the last patient case that's very common is steroids.
Oh,
right?
yeah, steroids.
Just in case there's a flare up.
Best drug, worst drug.
Yes.
Steroids are great. Great anti-inflammatory medications. Long-term side effects, cataracts,
It's
diabetes,
make you prone to infections. It can suppress your
suppression
immune
of
system.
immune system.
Blood sugar spikes, weight gain, mood swings, a lot of insomnia with patients who take steroids.
Right. But he gave it to his patient Angela, 40-year-old, and told her to take it anytime she felt mildly short of breath.
And if it's just a bottle of prednisone, patients don't necessarily know to taper off them, right? They
Right.
could just abruptly stop a high-dose steroid. It's very dangerous.
Right. Rule of thumb, if you're on a steroid more than 5 days, you should taper off slowly. What's the risk if you don't? Adrenal failure. And your adrenal glands, which sit on top of your kidneys, control things like blood pressure, and regulation of other hormones and bodily steroids like cortisol. So if you have cortisol suppression, and by taking chronic steroids, what we call glucocorticoids, you can develop adrenal crisis, acute adrenal insufficiency, because the brain says, hey, I don't need to have the adrenal glands produce more natural hormones, glucocorticoids, because they're already on glucocorticoids, and now we cut them off completely, and the adrenals don't have time to catch up. You have adrenal crisis. Bad.
Very bad.
Yeah.
Very dangerous.
So we don't support Dr. Justin Case at Preserve Health. We're going to bring him back for some future shows, but we just wanted to talk to you about our experience with Dr.
Yes.
Justin Case.
And don't see Dr. Justin Case. Come see Dr. Pearlstein or myself.
Yeah. Come see Leah again. We'll treat you correctly the first time. Thanks for joining us this morning on Preserve Health Talks. We look forward to seeing you again very shortly.